Dr. Sagu Moses, and he will also hand over his donation to the ministry. And at the end, we will get an overall remark by the Honorable Minister of Health and Social Services. Now, without further ado, I'm going to call on Ms. Martens Hausiku to the podium to give her remark.
Good afternoon, ladies and gentlemen, and thank you so much for the opportunity, Director of Ceremonies. Let me just acknowledge the Honorable Minister of Health and Social Services, Dr. Shangula, the Inspector General of the Namibian Police, the country representative of WHO, CDC, Tertius from Sanlam, and everybody present. Thank you for the opportunity. As was announced, I'm here in my capacity as the chairperson of the Public Enterprises CEO Forum. This is a forum that we set up in 2017. As CEOs, we came together and we decided that we wanted to have one voice that would speak to government, but also we wanted a platform where we could share commonalities on how we are running the public enterprises and also share best practices. This was established in 2017, as I said, as a non-profit organization under Section 21 company. I'm actually accompanied by the treasurer, my colleague, the CEO of RFA, Mr. Ali Ipinge, who is also here. In heeding to His Excellency, the President of the Republic of Namibia, Dr. Hage Geingoob's declaration on a state of emergency to mitigate the spread of COVID-19 outbreak in the country, the public enterprises came together under the CEO Forum. This CEO Forum has a membership of 48 public enterprises, and we pledged a total contribution of 1,215,000. This was collected from 10 public enterprises, namely the National Petroleum Corporation of Namibia, NAMCOR, and they pledged 200,000. Namibia Desert Diamonds, NAMDIA, they pledged 200,000. Road Fund Administration, RFA, they pledged 170,000. The Electricity Control Board, ECB, they pledged 150,000. Namibia Water Corporation Limited, NamWater, they pledged 125,000, and I must say that this was already paid. The 125,000 was already paid in the emergency fund for COVID-19. The Motor Vehicle Accident Fund of Namibia, 100,000. Telecom Namibia, 100,000. Agro Marketing and Trade Industry, AMTA, they pledged in kind vegetables worth 80,000 Namibian dollars. And then the Namibia Airports Company, NAC, pledged 50,000. The 50,000 was also already paid in the emergency fund. And then lastly, Namibia College of Open Learning, NAMCOL, they pledged 40,000 as well. The latest financial contribution comes in light of supporting the Namibian government towards the fight against further spread of the coronavirus, COVID-19 pandemic. COVID-19 is a global health pandemic which has also reached Namibia and led to the subsequent lockdown of Erongo and Khomas regions, and last week it was extended to the rest of the country. Ever since the outbreak, government declared it as a state of emergency with urgent measures to contain the spread of the virus in the communities, as the health of all Namibians is of primary concern. In view of this, as the chairperson of the Public Enterprises CEO Forum, we view this as a national pandemic and a major health crisis for the country's inhabitants, hence the need for us as public enterprises to join government in assisting them to fight this pandemic. It is a global health crisis of which Namibia is not immune, as we have seen over the past few weeks. We therefore saw the need to support and rally behind government's endeavors to fight against further spread of this disease and save lives. In actual fact, the well-being and safety of our people is of paramount importance, and we deemed it necessary for us to back up government by supporting them with the little that we have collected. At this juncture, I just wanted to announce that as public enterprises, after collecting 1,215,000, it was decided to spread it between the Ministry of Health and Social Services, but also the Namibian Police, NAMPOL, because we know that everywhere we go, if you are driving through town, there are men and women in uniform who are ensuring that the regulations that have been set in place during this lockdown period are being adhered to. It is important that as they carry out this important task, as they join the health workers, that they are also protected, and we deemed it necessary to assist them. So therefore, the amounts have been split as follows. About 384,000 Namibian dollars will be handed over or will be paid to suppliers who will assist the Namibian police. And then 576,000 will go towards the Ministry of Health. We also saw it fit that the 80,000 that was donated by AMTA in kind could be used by the police, as we know that there are also men and women in uniform who are manning roadblocks, and they are in need of some refreshments as well. I must say that there is already an amount that has been paid in the emergency fund, as earlier announced. I thank you.
Thank you, Madam. Mr. Ndeitunga, you can come. Can you move this side? Mr. Ndeitunga, please, you have the floor.
Thank you very much, the director, for proceeding. I should thank Madam Ausiku, the CEO of the public enterprise, to invite us to receive the donation that was just introduced now in the amount of more than 300,000, and as a share with the Ministry of Health and Social Services. I wish the amount could be changed, the 500 to us, and the 300 minister, I think. So it is my pleasure and honor to stand here to thank the public enterprises, for their modest donation to meet the government halfway. I'm here with the Commissioner General of the Namibian Correctional Service and other commissioners like Commissioner Nelumbu, Procurement and the Logistic, our Public Relations, Deputy Commissioner Kauna. You might have heard about them. Can you stand up, please? And come here so that the minister can see you very well. So they are the witnesses of what we have received today. Please have your seats. It is really a pleasure to inform you all, ladies and gentlemen, that I should first observe the protocol already established and to inform you that the whole country is locked down. Locking the country down means that we should stay at home. I have seen that people, it seems they don't understand what should be done under the concept of locking down a country to avoid a lot of movements, unnecessary movements, as we are still seeing in different towns and the villages. People are still moving left and right. We have set up all the roadblocks in different zones, on the 10 zones, but we are very grateful to receive this donation because it will assist us to assist those frontline men and women who really need different assistances. We are told that there will be some consumable items. We need to supply them with water, with PPE, and so that we make sure that they are comfortable in enforcing the regulations that were made under the state of emergency that has been declared by the head of state, the President of the Republic. We are facing challenges still, that the country is big, the checkpoints are many, they're about 69, the whole country, and all the security clusters, the NDF, the Correctional Service, the Namibian Police, are scattered all over, 24 hours, trying all the best to enforce the regulations. And therefore, when we are talking about prioritizing our workforce, both health workers and the security sector officers or officials or members, we, together with the nurses, we are working together. And whenever you make a statement, don't separate us. We are at the front line together. I remember one night, someone passed on, and nobody wanted to touch the body because they didn't know what happened to the body. The first thing the hospitals and the health workers did is to call the police. Police without PPE, everyone was looking at the body like looking at a ghost, what to do. But fortunately, it was a natural death, and everybody was scared. But we were together in the front line with the nurses, with the police, the army, in the streets. And apart from the enforcement of the regulations, we are involved in the normal policing activities. And we are arresting. And when we are arresting, we need to be properly equipped with protective equipment, so that whoever you touch, to whoever you talk, you are sure that you are protected. And this assistance will make a very great impact in the assistance of men and women in the uniform. And we are very grateful on behalf of our ministries, Defense, Ministry of Home Affairs, Immigration and Safety and Security, and on behalf of the rank and file in uniform who are currently on duty everywhere. Currently we have got our rivers full, being Kavango, Zambezi rivers, and the porous borders. At the borders, we have to patrol the borders to make sure that there are no intruders who might also bring in the effect of the coronavirus. And we are at the border. People from other neighboring countries are coming with canoes at night, sometimes bringing contraband, and we don't know, they might also be transmitters of the coronavirus. Be assured, members of the public, the whole nation, that we are there. But we can only achieve and succeed if we stand together as a nation. The Namibian security cluster will need proper cooperations with the public. We need to be assisted. Wherever you are, you should be the informer or the ears and the eyes of the state to report untoward activities, people who are sneaking in the country on time so that we can act. Therefore, on behalf of my colleagues, I thank you very much, Ms. Ausiku. We've been working together. Let us continue for the better health society of our country. And I thank you.
Thank you. Thank you, Lieutenant General. I'm now going to call on the Honorable Minister of Health to come and receive his donation from the Public Enterprises CEO Forum. Thank you, ladies and gentlemen. We are going to move over to be getting remarks from the CEO of Sanlam, Mr. Tertius Diaz, and then he will also be handing over his donation to the ministry after this.
Thank you, Honourable Minister, Inspector General, Rosalia, other colleagues. Thanks for the opportunity to also pledge something in this very important cause for our country. As an insurance company, the health of our nation is critical to us, and therefore we're glad to be in a position to support the ministry and the country in this fight against this pandemic. Allow me this opportunity. We on Friday announced that the group which currently operates in 27 African countries, will pledge an amount of $4 million in cash as well as in kind to the pandemic. Most of this money will be allocated to protective wear, which we'll touch on later, water sanitation, e-learning, the National Fund, the testing and screening, and we've also supported the city with some immediate needs in terms of water supply to some of our needy people. Honourable Minister, today we will be supporting 200,000 rands or dollars for protective wear, and then also a Mobi van that will be used for screening and testing across the country. The van is outside, and the colleagues can take some pictures, but we hope that that can aid the cause of the support and testing, which I think is very much needed across the country at this point in time. Allow me also to thank all the colleagues. I think we've heard your comments earlier on the importance of the health workers, and we fully want to support that and thank you for the effort already done so far, but at the same time also for the forces and the armed forces all supporting our cause. So with that, thank you very much for the hard work that you're doing for our country, and we hope that our contribution can be well used and can support your cause. I thank you.
Still some for me. No, not now. Not now. I can go to us.
All right. Thank you, Mr. Steers. Thank you to Sanlam for that donation. I am now going to call on Dr. Eric Juben from CDC to also provide a remark and do his handover.
Thank you very much. If I can stand on all protocols observed. I don't need to talk for long. I'll actually be back tomorrow in the afternoon for the session here as well. But I did want to take this opportunity to say that CDC Namibia is very pleased to have been able to immediately provide some close to support to the EOC, thanks to our longstanding partnership with the Ministry of Health and Social Services. CDC's actually been here in Namibia since 2002, and our commitment to the Namibian public is unwavering. And we've had multiple CDC professionals and experts dedicated full-time to the Emergency Operations Center efforts. Response efforts have included the public hotline staffing, contact tracing, case management, communications, data management, and laboratory testing, to name some of them. And I looked up our records today, and I saw that we've already spent a total of over 2,000 hours in Namibia's EOC since the first cases arrived last month. And none of us arrived because of the coronavirus. We were already living here with staffing this office, living here with our families, working together with the Ministry of Health for years. So it's really our fight too. We know that the PPE needs to be preserved for those frontline health workers, but the emergency personnel running Namibia's response also need protection. So with this in mind, we're happy to be able to provide these Namibian-produced cloth masks for every person working in the EOC as a way to help protect both the CDC staff and then also the Namibian civil servants, the WHO staff, everyone else working side by side in the essential emergency functions. So we bought hundreds of them. I only brought a few with me here today. We were actually on our way to take them over to the EOC, but they asked me to come here first. So these masks are going to be useful, but I really think the real story is our partnership. It's only continued to strengthen through every health challenge that Namibia faces. And like I said, we're all in this fight together, so thank you.
One more, Honorable Minister, before. Yes. Okay. The second last item on our program, it's going to be a remark by country director of WHO. Country representative of WHO, Dr. Sagu Moses, and then a handover of his donation.
Thank you very much, Director of Ceremonies. Let me also stand by the protocol already established. And since I have been here already in the afternoon, let me just say how pleased we are to be working with the Ministry of Health under the leadership of the Minister, and that since the first 2 confirmed cases in the country, we've been really supporting the ministry. But even before that, we've been working hand in hand together with our partners. And on behalf of the UN family, the World Health Organization would like to really make this presentation, which is made up of the PPEs that 4 sets, PPEs, which would be able to equip well over 1,000 health workers. We also have provided over 1,000 swabs for the lab, as well as some reagents. We have provided support in terms of human resource. We brought in experts to support the work, both from within and externally, and be engaged in training, the preparations of standard operating procedures, We have been involved in the risk communication, producing leaflets and other information, educational and a product. And we have really invested quite a bit of resources into this. But we know that this is a worthwhile investment because we are protecting ourselves and that we are making Namibia a safer place to be. So once again, on behalf of all the UN family, we'd like to make this presentation with to the Honorable Minister of the PPEs.
Please remain. Thank you, Dr. Sagu Moses. We are now going to be having the last item on our program, and this is going to be a remark by Honorable Minister of Health and Social Services. And after that, we will be closing the program. Thank you.
Thank you very much, program directors, members of the high table, ladies and gentlemen. This is a pleasant occasion for me. I am overwhelmed by the support extended to our response to COVID-19. I would like to thank the CEO Forum, the Public Enterprises CEO Forum, represented by Ms. Hausiku here, for the generous support of an amount which together exceed 1 million. I was carefully listening to what General De Tunga was saying, that he would like that the figure earmarked for the ministry should be switched over to the security cluster. But he doesn't know that even that the money which was said to go to the security cluster is actually coming to the Ministry of Health and Social Services. So you basically have nothing. Thank you very much, men and women of Namibia, for assisting us in this response against our common enemy. The representative of Sanlam, you are playing an important role in our society. The insurance company actually insure many things, but I wish you could also insure the lives. But thank you very much for your generous support to our cause. It is in the interest of all of us, because if we don't put our efforts together, if one falls, all of us are bound to fall. Let me also thank Eric. I call him ED because the same name is a bit difficult for me. So I shortened to ED. That's how I always call him. Well, our ties goes many years ago. And of course, we appreciate both your technical and your financial support, not only in the event of COVID-19, but also in many other fields, hepatitis E and all other areas of our public health. To my brother from WHO, thank you very much. You have been always a reliable pillar to lie on for your technical advice and for your support, which has also today been manifested in the donation which you gave to the Ministry of Health and Social Services. Today's theme in the afternoon was about protecting the health workers. And it's so coincidental that all the donations which we have made here today, they goes towards the protection of the health workers. Namibia is very fortunate that since the outbreak of COVID-19, we have been guided by the exceptional leadership provided by His Excellency, the President of the Republic of Namibia, and also for the fact that he was able to put up a unique command structure which has guided our efforts so far. I must say that what we have achieved so far, although it's not something that would allow us to relax, it's something which is worth being proud of. And I would like to call upon the Namibians so that we continue on this trajectory until finally we beat the invincible enemy. I am overwhelmed, especially by not only the donation, but the goodwill behind the donation. And this will remain a source of our inspiration as we march forward. I would like to call upon everybody to work together with us so that we reach the victory. I have already last week announced that we are going to step up our testing capacity and capability and extend to other regions as well. We would like to know the magnitude of the problem in our country, and we are going to move forward in this direction. And again, I would like to call upon the public to cooperate with us. We have nothing else but your interest at heart. And please believe us what we are telling you. And we saw that we also believe in you. I would like to end here and thank you very much for your kind attention.